Good afternoon and welcome. This is Lori Smetanka, Executive Director of the Consumer Voice. We're glad to have you with us for today's webinar, a closer look at the relationship between resident satisfaction and quality measures in nursing homes. This webinar is part of a project led by today's speakers, Dr. Edward Miller and Dr. Pamela Nadash, and I'll introduce them in just a minute. And the project was also funded by the Donahue Foundation, and it examined the relationship between satisfaction and existing quality measures and facility characteristics. The Consumer Voice has been a partner on this project with Drs. Miller and Nadash. So our speakers today are Dr. Pamela Nadash, Associate Professor of Gerontology at the University of Massachusetts, Boston, in the McCormick School of Policy and Global Studies. Her work centers on policies that enable people with needs for long-term services and supports to receive appropriate services. She has a special interest in managing long-term care and has been heavily involved in consumer-directed services and policies that support informed choice. Dr. Edward Miller is a professor of gerontology and public policy, also at the University of Massachusetts, Boston, in the McCormick School of Policy and Global Studies. He has more than 25 years of experience in aging and long-term services and supports research and design, and in analyzing the determinants and effects of federal, state, and local policies affecting vulnerable populations. A few housekeeping items before I turn over to the presenters. All of the participants will be on mute or listen-only mode during the call. You can type questions into the question box on your control panel, and we will respond to as many questions as we can at the end of the presentation. Also, this webinar is being recorded for future use and will be posted to our website. And with that, I will turn it over to Dr. Nadash to start today's presentation. Pam, I'll turn it over to you.
Thank you so much for that introduction. This has been a great project. It's been wonderful working with this group. Just to sort of expand on what Lori was talking about, this project is here. Okay, here we go. It's sponsored by the Donahue Foundation as a research project to understand this issue of how satisfaction relates to quality. This presentation was also part of a presentation we did at the annual meeting last November in DC with Consumer Voice. And as part of that, we were very pleased to get consumer feedback on our project. And so this webinar is an expansion of that for those of you who were not able to make the annual meeting. We're very, part of the Donahue Foundation's interest is not just doing research, but engaging, community players and advocates and research so that the research can actually be used. So we will be really, really interested in your perspective and your take on this. And the content of the presentation has been designed with you guys in mind. So it's less of an academic presentation and hopefully more useful to you as advocates. However, if you are interested in any of the more detailed research components, we're happy to expand on that or to lead you to further resources. Okay, so we've talked a little bit about what the study is. I also want to, in addition to mentioning my colleague Eddie Miller, who's on the line with us now, we also have a number of other people who have been working on this project with us, most notably Jennifer Heffley, who also does a lot of work around nursing home quality, Katrine Gorner as well, and our research assistants, Edrita Barua and Joyce Wang. Also, we have the team from Consumer Voice who have contributed to the design and execution of the project. And then we also have a number of advisory group members to advise us. So let's go into the background of why this topic is important. The key issue with nursing homes, as you guys all know very well, I'm sure, is that we really don't know what we're getting ourselves into when we think about, how good a nursing home is for our loved ones. We don't have great information to work on. So as you all know, the federal government has set up the Nursing Home Compare website that's supposed to provide information to potential consumers of nursing home products with the information they need. And that information right now is not seen as being all that great. There are a lot of deficiencies. There are a lot of problems with that information. And so the theory is that by getting the consumer's point of view about what they think about nursing homes are like, to get their overall level of satisfaction with their experience in the nursing home, and not just the resident themselves, but also family members, to get their take on the nursing home experience, that would be a really important piece of additional information for somebody who was thinking of, sending a loved one to that particular nursing home. So the general idea is that the information we're getting right now just isn't all that great. You guys all know that states survey nursing homes and mark them up for deficiencies, for inadequacies in particular areas, and that the value of those surveys really depends very heavily on the level of training of the surveyor and the extent to which a state puts resources into conducting these surveys. So how those surveys are done are really very important, and not everybody's happy with that. We also get clinical quality indicators that are used for the Nursing Home Compare website, and those assess, certain outcomes, things like antipsychotic medications, things like that, whether nursing homes are doing things that are not good or not. And then we also, Compare also has staffing measures in it. And we also get some information about quality from complaints or lawsuits or ombudsman reports. And again, those are all inadequate. So the idea is that satisfaction is a different take on things, and it tells you different information than quality does. Another reason for collecting satisfaction information is that this is just how it's done nowadays. Nowadays, when we want to buy a toaster, we go online and we read up on everything, and we read a gazillion people's point of view about whether it's a good toaster or a bad toaster. We know perfectly well that sometimes people only post when they're mad about their toaster, when it's a bad toaster, so we don't necessarily take what's posted online as the last word, but we're glad for that information. We're used to being able to get that kind of information. So why shouldn't we get that same kind of information, about what other people thought about this product? Why shouldn't we get that information about nursing homes? That's another kind of argument for collecting satisfaction data. And another important one from policymakers' perspective is that that by collecting satisfaction information, you're going to improve the quality of nursing homes. And you're going to do that through two different mechanisms. Number one, consumers are going to see the information and they're going to say, oh, I'm going to pick a better quality nursing home. So the nursing homes are going to compete for the market by improving their satisfaction scores. And then another one is that, well, okay, actually we kind of know that consumers don't use the Nursing Home Compare website, and they might not actually know anything about this, but it matters to the nursing homes themselves that they know about these quality scores and that they want to be better than their competitors in the market. So it doesn't necessarily mean that you have to rely on consumers knowing about it and using that information. Sometimes it's good enough that nursing homes use that information. Okay. And anecdotally, people have told me that nursing homes also look at specific aspects of satisfaction when they do conduct satisfaction surveys, and they see where things have gone up or down, and they think about where they need to improve their performance. So satisfaction information and consumer experience information can be really useful to nursing homes themselves. Okay, but a lot of people say, well, maybe satisfaction isn't really such a great thing. And this argument has a number of different kind of angles to it. And the first one is really that just because people are satisfied doesn't mean that what's happening is good. And so I've got here an example of a very nice doctor who isn't very competent. So you can have this sweet, lovely doctor who's very kind and has great interaction skills. But maybe that nice, lovely doctor doesn't actually know very much and doesn't actually do a very good job. So your experience of that person, you might give them a high satisfaction rating, but that person might not actually be very good. Another really big argument is that sometimes collecting this kind of information can provoke the wrong behaviors. And so the example here would be something like they now collect satisfaction information in ERs for nurses. And now what you have is you have ERs coaching nurses on how to get good scores. And so the nurses are very nice and lovely and everything. But it's a lot of misdirected activity. If you're collecting satisfaction information about hospitals, people like having pretty rooms, for example. Well, would you rather have a pretty room, or would you rather have money spent on other stuff that might be more important to your actual health? So that's that last point, is that there is some kind of evidence for the fact that people sometimes focus on aspects of care that aren't necessarily very related to the clinical quality of care. But that argument kind of falls down in the face of the nursing home experience, which is a much more sort of global experience. And while you can argue that, oh, well, if I'm getting heart surgery, it doesn't matter if the waiting room is pretty, because all I care about is having a good surgeon, that argument in a way doesn't necessarily work that well for a nursing home experience, where the actual lived experience is incredibly important to people. That kind doctor is incredibly important to people. That's the quality of their day-to-day life. And all those elements are actually very, very important, as well as the clinical quality of care and the technical ability of CNAs and so forth. And overall, even with respect to that argument about hospitals, there's a lot of research out there that shows that actually satisfaction and quality do tend to align fairly reasonably. And there is some negative evidence, but overall it's pretty strong. Okay. Another really big argument against satisfaction is that, unfortunately, when people do surveys, they score pretty, most people are pretty satisfied. So you can look at that and you can say, well, if everyone's getting high scores, that can't mean very much. And there are some good reasons why the scores are high. One is that when you think about somebody going into a nursing home, they don't expect high quality. They think it's going to be terrible. It's a nursing home, so they have very low expectations. So if the nursing home is even halfway decent, they might be pleasantly surprised and give it a high rating. Another argument is about coping, which is that, basically, I'm living here, so I'm going to make the best of it. It's a great experience. And then the third point is called social acceptability bias. Basically, people want to please. So if somebody is asking them, is it good? They're going to say, yeah, of course. Or they might be worried that they'll get in trouble, or people might not be nice to them if they put a low score. And then, of course, there are a whole bunch of other things that influence how people rate satisfaction, which are very individual level as well. Okay, so those are some of the kind of general arguments for and against collecting satisfaction. We're going to go over a few more later. But at this point, I just want to pause and let you know that, let you know that we think about, I've used these words, experience and satisfaction, kind of interchangeably. And there's actually a technical difference between those two words. And so the satisfaction really, so let's talk first about the experience. Experience is really about these very specific aspects of the nursing home experience. So focusing on very specific things that people can evaluate, such as the food, whether they're treated with respect. So some of these questions are things like, do you feel you're treated with respect by the staff? It's very specific. Is the physical environment nice? Do you feel like it's clean? Do you feel like the nurses know what they're doing? All these things are very specific aspects of experience. Satisfaction, on the other hand, is more global. It's meant to be a much more subjective representation of how you feel about the whole thing. It's much more global. And it's usually assessed with these two questions. Overall, how do you rate your satisfaction with the facility? And then this one, which is kind of interesting and different, which is, would you recommend? So sometimes what people say is, yeah, I rate this facility pretty highly, but no, I wouldn't recommend it to anybody. So you can understand how that's actually kind of a meaningful and interesting difference. Okay. So let's also talk a little bit about the different types of surveys. I've already indicated that satisfaction surveys typically are sent to family members and also to residents, and that sometimes they're separated out into long stay and short stay residents because those two groups have different experiences and needs. There are a bunch of issues around the administration of the instruments, and one of the things I've heard from advocates is concern about how exactly it's done. So, for example, if one of the nursing home staff is sitting down with the person while they're filling out the survey, you can understand why the results you might not trust the results. So are staff providing help with filling out the survey? Well, sometimes they have to because the person isn't able to respond to the survey themselves. Sometimes people are relying on third parties to help them respond to the survey. And then we also have a lot of issues around response rates. So I actually talked to some nursing home administrators about how they do this. And what they do is they put the paper surveys into people's mailboxes, and then they have the person collect, put the responses back into a mailbox or something. And typically the response rates are pretty darn low. So that's a problem. Okay. So that's sort of how nursing homes, how these surveys are being done. I wanted to add the policy perspective on satisfaction. So I talked a little bit about why we might want to collect satisfaction in terms of representing a different point of view. But I also want to sort of point out the fact that the nursing home sector is a little bit unusual and it's a little bit left behind because this is something that's already happening. It's a big policy trend in other areas of healthcare provision. So right now, the federal government is rolling out this thing called CAPS, and it's currently being used in hospital care and home health, Medicare Advantage plans, hospice care, and it's actually required by law for a number of types of providers. Even where it's not provided by law, it's being incentivized in other ways. And the other thing is, in the home health arena and the hospital care, the results of these satisfaction surveys are being publicized. So it's not just being collected. People are able to use it to make decisions between different providers. Okay. So here I've provided for you a kind of example of what the Home Health Compare website looks like. And you can see there that, these specific questions are listed, and you can see the proportion of people who agreed or didn't agree with certain things. So 88% of them, of the patients for this particular home health agency, for example, thought it was good. 92% felt that the home health team provided care in a professional kind of way. You can agree or disagree with the specific items they choose to present, but at least this gives you some kind of picture of how they perform how this home health agency stacks up against the Massachusetts average and also how it stacks up against the national average. On the other hand, this doesn't happen in nursing homes. However, a lot of nursing homes are doing this on a voluntary basis. The ACA website lists 14 different nursing home survey vendors. So there are a whole bunch. There is quite a lot of activity going on independently. The My Interview instrument, which is the one we used for our particular study, is currently being used in about 2,600 nursing homes across the country. So as I mentioned before, nursing homes find this information useful because they use it for performance monitoring and, of course, for marketing. So they see good reason for collecting this information. Nobody's actually aware of what the actual level of activity is because we just don't have information on that. But it does seem like quite a lot of nursing homes are doing this voluntarily. Okay. The interesting part is that some states are actually requiring that nursing homes collect satisfaction data. So in many things in healthcare, what happens is states initiate new wonderful things and it rolls out more broadly. So currently there are a number of states that are requiring this. So right here, what I've got is the Minnesota nursing home report card. And Minnesota is one of the states that requires all nursing homes to collect satisfaction data. And they also present richer information that is otherwise available on the Nursing Home Compare website. So I think if you look at this, for example, you can see that this particular nursing home, I think it's interesting from a number of angles. Firstly, you can see over time how the nursing home has changed. So it did really badly on the state inspections back in 2012, and its record is slowly improving over time, which is great. In terms of the state inspections, it's getting 3 stars on family satisfaction. That's not so great. That's kind of middle of the road. It has temporary staff agency use, which is a really interesting indicator because it tells you how much, that's an indicator of quality. I'm sure you guys all know that using temporary staff means that there's less continuity and less likely to have high quality care. So that's an example of one state and how they use satisfaction information. So what this all boils down to and what our project is trying to feed into are these big questions about whether government should in fact require nursing homes to collect satisfaction or experience data. And the other part of it, okay, so all right, you collect this information, what do you do with it? How do you use it? So I've talked a lot about how the information could be incorporated into public reporting, such as the Nursing Home Compare website or those websites I just showed you, like the Minnesota website. The other thing that it can be used for is P for P, pay for performance. So do we want nursing homes to be incentivized financially to improve their satisfaction scores? That's something that is very big right now in the health policy field. The federal government is encouraging a number of different experiments with pay for performance in lots of different areas of healthcare. Theoretically, this could be used in that particular kind of way. The question is whether that's a good idea or not. All right. Okay. So from a research perspective, which is our take as the researchers on this project, people aren't really sure the extent to which nursing home satisfaction relates to these other measures of quality. So this goes back to what I started out with, which was this big question about, are we measuring the same thing? And if we are measuring the same thing, then doing nursing home satisfaction surveys is kind of a waste of time and money, because why would you want to just collect different information that pretty much tells you the same information? So the question is So that was, the name of our study, which is what is the association of nursing home satisfaction with quality? Are they overlapping constructs? And what predicts satisfaction in nursing homes? That's a really big and important issue. Are they the same things that predict quality? Because there have been a lot of studies of quality in nursing homes, and what are the things that contribute to quality in nursing homes? Are those the same things that contribute to satisfaction? And the other interesting angle to think about is how do those factors differ between families and for residents? So sifting through all this data, for example, it's very interesting to see the differences between what family members think are important and what residents think are important. So I had a lot of tables that I could have included in this presentation. I didn't think you guys would be so interested in the nitty-gritty details, but so the details are in fact available if you're interested, and we are currently in the final stages of finalizing a journal article that has a lot of this information. And so lots of detailed information on all these things that I've just mentioned. Okay, so one of the things I thought you guys would be interested in is just overall, how satisfied are consumers and families? Now, I should probably take a break. I did cut out a number of tables, but I should firstly familiarize you with the extent of the nursing homes that were included in our study. And we included about 2,000 nursing homes nationally. And as I said before, we had a big sample of nursing homes that use this My Interview survey instrument. We had to cut out quite a few of the cases because they didn't have enough responses. So initially we included all nursing homes that had 5 or more responses to the survey, which is pretty darn small. And then we decided that wasn't good enough, so we would only include nursing homes that had 20 or more responses. So of course, the folks that we had a look at whether the nursing homes that used the My Interview survey were different from nursing homes nationally, and we did find some differences. They did tend to be slightly higher quality, and they were more likely to be chain nursing homes. So they were a little bit different, but not too much. So hopefully our results have validity for all nursing homes nationally. But we did also have a pretty good number of nursing homes in the survey. So hopefully this, the thing that makes our study special is that it does cover all nursing homes nationally, and it's a pretty decent sample. So there have been studies done before about nursing home satisfaction, but they tended to be only in the states that do this satisfaction, require satisfaction surveys: Minnesota, Ohio, and Maryland. And so they're not covering the whole country. So the first question we were interested in is, generally speaking, how satisfied are consumers and families? So here we have one of the tables that I thought might be interesting for you. And what you see in this particular table is what are the average satisfaction scores for residents and for family members. And so what we see is that we're looking at quality of life scores, quality of care scores, and the last 2 items right there in the bottom are overall satisfaction and the would you recommend question. And I don't know if you think those are high or low or whatever, but right, to me they seem, people are pretty much satisfied, but the numbers aren't too ridiculously high. What's kind of interesting is that on average, residents and families do pretty much, rank them reasonably highly. But one of the things that will be interesting for you guys is to see correlations. In other words, how much do these different scores agree with one another? Okay, so this particular table shows you that about a little bit more than half the time, the family member agrees with the resident in their rating of satisfaction. So that probably tells you something you guys already know, which is that family members and residents have a different point of view about things. And then the other thing is, the big question is, do the quality scores agree with the satisfaction scores? And what you see in the bottom section of the, here, I think you guys can see my pointer. So right here, this is what this particular one means, is that the nursing home 5-star rating from the Nursing Home Compare website agrees with the resident satisfaction score only about 30% of the time. So that's not a lot. It agrees with family satisfaction 36% of the time, which is a bit more. It does not agree very much with the number of quality life deficiencies that the nursing home has received. So you guys all know about the survey deficiencies that are provided. So what we looked at for this, to get this result, was we looked at whether a nursing home had any deficiency scores in quality of life. And the idea here is that if resident satisfaction, there should be fewer deficiencies when people are more satisfied. And that's why you have that negative number there. But you can see that the level of agreement, those numbers are pretty small. So what we're finding there is that satisfaction, there is a relationship between resident satisfaction or family satisfaction with quality of life, quality of care deficiencies, but it's not a very big one, but it is statistically significant. Okay, so overall, we had a lot of factors that were found to be related to satisfaction. So what I showed you before, these are just correlations, what are called bivariate correlations, so just two numbers. We also did some analyses where we controlled for a whole lot of different factors. And when you talk about controlling for factors, what you're talking about is taking into account, for example, that a certain facility might have more Medicaid residents. Well, Medicaid residents means that a higher rate of Medicaid residents means that on average, the quality is going to be lower. So you want to adjust for that in your analysis. So we adjusted for a whole bunch of different factors that were likely to influence the level of satisfaction in a given nursing home. And so what we found after all these factors were taken into account was that really the relation for residents, the biggest thing that contributed to their satisfaction was quality. But the only quality measure that influenced their level of satisfaction was the Nursing Home Compare 5-star rating, not survey deficiencies. So the bottom line there is that survey deficiencies don't really influence satisfaction, all other things taken into account. On the other hand, you guys also already know that there are a lot of facility level factors that influence people's experiences, such as how big the facility is, how many Medicare or Medicaid residents are in the given facility. And again, consistent with all the other research out there, all these things did actually influence satisfaction as well. The big surprise was that staffing had so little influence on satisfaction. You would think that the number of CNAs, and I went into this research thinking that the number of CNAs would have some kind of impact on satisfaction, but in our study, the results did not support that. So that was for residents. Family members, the results were more robust. And that could be because the sample was a little bit bigger for the family members. So what we found in this one was that all of the quality variables were significant. So that the nursing home compare rating was significant, and the survey deficiencies were significant. The staffing variables were also significant. And a lot of the facility level factors were important, such as the nursing home profit status. So again, you guys are probably really familiar with all the research that shows that for-profit nursing homes tend to be lower quality. So in this particular case, what we found was that people were more satisfied with not-for-profit facilities. Okay. So things that did not predict satisfaction. We were interested in whether for-profit independent nursing homes were had any influence on quality. We didn't find that. We didn't find that RN staffing mattered, and we also didn't. We thought that maybe how competitive the market was might have an influence on satisfaction, and that hypothesis was not supported. Okay, so what does this all mean? This means that the nursing home compare 5-star rating is in fact to some extent meaningful in terms of its influence on family and resident satisfaction. A lot of people argue about the nursing home compare measures. Is it a good measure or is it not? Does it reflect quality or not? You know, my explanation for why it seemed to affect satisfaction is because the nursing home compare 5-star rating takes into account a whole bunch of different things. It takes into account staffing and survey deficiencies and clinical quality of care. So obviously that has something to it. There's something about that seems to affect resident and family satisfaction. Deficiencies, I should have edited this a little bit. Deficiencies had less of an influence, but they also seem to have some influence. So it seemed to be a weaker association there. But the bottom line, really the takeaway from all this is that the associations were not that big. So there's a lot of stuff going on there that is not explained. So we think that, when you conduct this kind of study, what you do is you throw in all the factors that you think are going to influence your outcome, which in our case is satisfaction, and you hope that it explains the outcome measure. And basically it doesn't. There's a lot going on there that is unexplained that we were not able to incorporate into our statistical analysis. So, and that probably doesn't surprise you. There are probably a lot of things that feed into satisfaction. But the key thing is that we're just not measuring them and we don't understand them. So that to me suggests there's a lot of room for more work on this. And the other part of it is that, again, we knew this kind of, but it's nice to see it backed up by our research, which is that family and resident satisfaction are two entirely different things. They only agree half the time. You cannot take the family satisfaction as a proxy for resident satisfaction. They're different things. They both have valid, points of view or information or whatever you want to say. They're valid in their own ways, but they're not the same thing. So I think that's something that's very serious and important that we need to think about when we talk about satisfaction levels, to be really clear what we're talking about and to think about what's the best way to collect information from these different groups that actually collects the information well. So the bottom line here is that satisfaction does seem to capture very different things than other quality measures do. So, for you as advocates, what you need to think about is do you think it's worth trying to influence government to collect this information? Do you think that this information is so valuable that we ought to require nursing homes to collect it? And do you think it would be useful information for people to have when they're making choices about nursing homes? So, if you were to think about selecting a nursing home, would you want to know how satisfied residents and families are? And if so, how would you want that information presented? Would you want it to be part of a government-sponsored website like Nursing Home Compare? Because obviously out there in the policy world, there are lots of different ideas about how to do this. Some people, for example, have suggested, a Yelp kind of thing. But again, I'm sure you guys all know that Yelp is not perfect, right? Sometimes people get mad at the owners of a restaurant and they decide to flood it with negative reviews, or maybe they get their friends to write lots of positive reviews. So we know that, online reviews have their pros and cons. So the question for you really is, is there something that you think is valuable? And if you do think it's valuable, do you want to invest political capital in it? Is it something that an organization like Consumer Voice is going to want to get out there and lobby on? Now, we all know that there are plenty of other really important issues out there that need to be tackled with respect to nursing homes and nursing home quality. So, is this a priority for you? Is it something worth doing? So I'm a little bit before time, but I think that pretty much closes it. And right now what I'm going to do is I am going to hand this over to my colleague, Eddie Miller, who is going to moderate a conversation. Okay?
Okay, sure. Thanks, Pam. So there have been a number of comments so far. I think what I'm going to begin with is just some of the comments to clarify some of the methodology and results, and maybe we can answer those first, and then go into some of the broader issues. So there's a question about the scale. Was it 1 to 4? Pam, what was the scale for the satisfaction scores?
It's 1 to 4, yeah.
1 to 4. So those were pretty high scores. All were averaging over 3.0, I believe, right? So definitely in the upper quartile. And again, that's generally what you see more broadly in the health sector. And one of the issues that Pam brought up earlier is that people tend to rate the satisfaction of their providers relatively highly. And so, but there is enough of a difference where it does become meaningful for consumers. On the other hand, if a provider is rated fairly low, there's something really serious going on there. There's a question about the inclusion of both private and government-funded nursing homes. I believe, can you clarify that? Pam?
Well, yeah, so we did not include government-funded nursing homes, which are typically VA nursing homes, which are quite different from the nursing homes most people use, kind of a different kettle of fish. But this did include, when you say private, there are kind of a bunch of different categories of private. So there's private for-profit, private not-for-profit. There are independent nursing homes, and there are chain nursing homes. So those were the 4 kinds of categories we used to classify, and all of those groups were included. So private for-profit, private not-for-profit, private independent, private chain.
Right. And this question is, how did the number of Medicare and Medicaid beds impact resident satisfaction? Do more Medicare and Medicaid beds mean greater satisfaction or less satisfaction? I don't recall that specific finding, but we did look at it. Pam, do you recall that?
Off the top of my head, I couldn't say it.
Okay.
I would need to check it.
Yeah, we're happy to share these additional details later on. We just don't have them at our fingertips at the moment. There was also a question about responses and about building the number of responses. So I believe this pertains primarily to how do you're not serving not everybody gets served in a nursing home. Some do not respond to the surveys. So it might be worth speaking to just the process that my interview goes through in order to recruit, in order to get, what's the process of actually, how is this actually administered, is, I guess, the question.
Right. Okay, so I agree that this is a big question. And my responses to this are, again, kind of non-scientific, just based on conversations I've had with nursing home administrators. And actually, the process of doing this research project really prompted so many questions in my mind about how actually this is done, that we started up a separate research project around that to try to understand, what actually happens with respect to these kinds of surveys. What is the motivation of nursing homes to do this, and really just questions like that. But the short term of it is, sorry. Hello. There's a lot of background noise. Please mute if you're not on the phone. So but the short answer is that nursing home administrators don't have a lot of incentive to encourage people to respond to these things. Because, again, as I said, a lot of the nursing homes that conduct these surveys tend to be chains. I'm sure that what happens is, you have the head office telling people you got to do this. The people who are actually doing the survey administration, it's another job they've got to do, and they're not really invested in it being done well. So I think that's one of the things that would need to be thought about if we were to roll this out on a broader basis. Why, what's the incentive for people to do this properly? Because whenever you think about the requirements for nursing homes, it's just another thing for nursing home staff to do. So I kind of understand why there might have been low response rates, and it would certainly need to be addressed.
Yeah, and there were some questions about, how does, what informs people's responses to these questions about their satisfaction, whether they would recommend a nursing home. And, so one is, did you study staff attitudes and our training relative to resident and family satisfaction? And another related to the role of potentially consistent assignment, and is that considered in the surveys? Pointing out that this factor, consistent assignment in particular, is related to level of staffing as well as turnover, based on their experience, on this individual's experience as an ombudsman. And I guess the short answer is no, we didn't look at that. We were only able to look at what we could look at given the data that was provided to us, which was, it was individual level data sort of aggregated to the facility level. But these are good questions. We looked at the level of staffing and its relationship to satisfaction. But what about staff attitudes and training more generally? What about how staff are used? And so this is certainly something that we think could be explored, more so in the future. Pam, would you want to add something?
Yeah, I mean, I agree with Eddie. These are great questions and all worth paying attention to. But the thing to emphasize is that this whole area of interest is really new, and there's not been a lot of research on it. So, I would agree with you. I want to understand what makes people happy with their nursing homes. But, right now there's very little out there addressing any of this.
Right. And, but, we could, it's possible to, we have the data that's available to us from Nursing Home Compare. We have this data on satisfaction. Now we just focused on the overall questions here. There are sort of questions about specific areas, about people's experiences in the different spheres of life and care that is provided to them, which might be a little closer to what you're trying to get at here in relation to attitudes and of staff and how staff are used. But we could also, you can imagine doing something where you actually go in and survey nursing homes and ask specifically about questions such as these, and then relate it to data that is otherwise available to us. And that certainly would be something that would need to be looked at in the future. But again, as Pam mentioned, surprisingly, this is a relatively little explored and studied area of investigation. More work has been done with this in relation to, say, hospitals and physicians, but very little in long-term care. And so this is just, our study is just one of relatively few that have been conducted so far. Another question is, was length of stay considered? Again, great question. Was there average length of stay in our models? I don't believe that was the case.
No, and in fact, I mentioned earlier that we had an article that was put in for publication, and one of the reviewers was really interested, what's the difference between long stay and short stay? And we weren't able to break the information out that way. So, again, as Eddie mentioned, I didn't really elaborate on this, but the data we have are aggregate. In other words, it's the nursing home average. So, in order to figure out whether, the influence of length of stay on satisfaction, you would need individual level information where, people who stayed longer, and you'd look at how satisfied they were, right? But yeah, that's a really interesting thought. I mean, it could go either way. Either people who stay there longer are going to do more coping, and they're going to, make it all sound like roses. Yes, or they're going to get more and more depressed and less satisfied. I'm not sure how I think that would go, but it's an interesting
And you have to
question.
imagine that what is important to people varies depending on whether they're in for a short-term rehabilitative post-acute stay, or whether they're in long-term, that the nursing home is their home. And so there are certain things that people might put up with on a short-term basis that they just wouldn't be willing to put up over the long term, and that could be reflected in the satisfaction scores. And so it's certainly important to look at short versus long stay. We just weren't able to do so with this particular data set. So did you use CMS Continuous Readiness survey process, resident and family interviews, or did you create a questionnaire on your own? So no, this was definitely, we did not do that. We relied on the My Interview data, and the main reason is that there were state level data sources available, and we did collect data from Minnesota, Ohio, and Maryland. But this is really the only national data source that we could obtain at that time, and so it was important for us to be able to. So for this study, we looked at we did account for the fact that observations sort of cluster within states, and therefore that people's experiences might vary depending on the state environment within which they're located. But it also will allow us subsequently to look at differences across states and across regions, and that's on our list of things to do. A number of long questions being asked. So, so this is Teresa Lewis. This talking about the experience in Minnesota. In our experience in Minnesota, we have found doing face-to-face interviews to gather the resident experience data is absolutely critical. This is due to the significant sensory and other impairments, making it hard for these people to participate in traditional paper surveys. We've also found the total cost of doing this, as well as mailed surveys to families in short stay residents, is reasonable at only about 1% of our total annual Medicaid budget. We strongly advocate for CMS, or failing that, other states to adopt resident interviews if at all possible in the future. And you know, that's an excellent point. And in terms of you know, my interview, you know, how it's administered in particular facilities. Do we ever we explored that somewhat, but Pam, you might be able to say more about how my interview was the data was collected and how it might vary across different nursing homes or across different states, and maybe sort of tying it back to what Teresa just sort of wrote.
Yeah, I think there are a lot of issues around how the data are collected, and I sort of alluded to that before when I talked about, you know, if you do use an interviewer, there's always that idea that they have to be independent, because if it's a nursing home staff, then people might not feel free to say what they think, and also this kind of, you know, so there's so many different ways this can be done that will influence the type of response you get. The impression I got from my interview people, again, you have to remember they're a commercial company, it's a business, they do not exert a lot of control over how the survey is administered. So it's really, as far as I could tell, left to the discretion of the nursing home administrators. You know, I don't want to be too critical, but that is not how one would want to do it if you were trying to get good responses. You would want to have, as the woman from Minnesota mentioned, you know, there are ways of doing this to ensure that the responses are, you know, there are higher response rates and the responses are more consistent, and also that the respondents don't bias the results, because, you know, you might only encourage the people who you know are happy to respond to the survey so that your nursing home gets a good rating. So, you know, it's very sensitive to how it's done.
Yeah, and I would, I'm sorry. No, and I would add that, you know, just like the point that was made about Minnesota and its approach to surveying residents, you know, I mean, it's really this type of information states learn from other states, right? But it's important that, you know, if Minnesota can demonstrate that, you know, this results in more valid and reliable surveys, that, you know, particularly relative to sort of traditional, you know, paper surveys, and that it actually, the cost isn't really much different. I mean, that's important, and that's important for other states to know about. So, you know, I think I strongly encourage, you know, that findings such as that, you know, be disseminated widely, because that's really how, you know, not just state governments, but also, you know, advocates, you know, learn from one another, and in terms of creating expectations about what should occur within their own states. There was an earlier comment about, you know, is anyone using residents or former residents to help other residents with the survey? There's a cadre of residents who work on Money That Follows the Person and similar programs who might be able to do this. I don't know the answer to that question, but you know, one thing is assisting people with actually doing the surveys and filling them out, and we just don't know about that. But on the other hand, it really also gets at the crux of people want to learn from other people's experiences, and whether it's you know, through these systematic surveys, or it's through you know surveys on Yelp or Facebook or what have you, and not just the sort of the scores, but sort of a narrative about their experiences. That, you know, the written word, people tend to connect with that more strongly, and also when people sort of describe their experiences in text, they touch on a number of things that aren't captured, you know, by a survey instrument, and so, you know, maybe it's not done in place of surveys, but in addition, and together you might be able to address more broadly the type of information people want to get before they make a decision about placement. This is a theory that one of the member of the audience came up with. I may be wrong, but I believe family members would tend to rate a nursing home in which their family member, more highly than not, because of the fact that their family continues to reside in that home. Given a choice, who would choose to leave their family member in a nursing home they rated as unsatisfactory? So I think people are generally predisposed to rating nursing homes more highly than they actually are. And she said, that's my little theory. So, essentially, people may be rating, family in particular, may be rating nursing homes highly for two reasons. One, they feel that they would only choose a high quality or home for their relative, and it would reflect in part in their ratings. But there may be, an issue in relation to cognitive dissonance here. Nobody wants to admit that they would leave their family member, perhaps in a home that doesn't perform up to what they would otherwise expect.
Mm-hmm.
Did you look at leadership's impact on satisfaction or continuity of leadership, team, and management? We did not. That's something we weren't able to get at, but it is an important question. Particularly in the nursing home staffing literature, work by Nick Castle and others have shown that leadership matters, right? And so stability of leadership, leadership qualities, more effective leaders tend to be associated, that tends to be associated with reduced turnover and greater retention. And so you would certainly think that might extend into the resident experience as well.
Mm-hmm.
How can we use this information to increase efforts to advocate for changes and improvements in care with facility staff? Pam, you want to take that?
Sorry, I didn't quite hear it. How useful is it?
Yeah, how as an advocate, how could we use this information to increase efforts to advocate for change and improvement in the care with facility staff?
I think that it goes back to, the point that I emphasized at the end, which is that, and I started with, existing measures only capture some of what matters to people, okay? So we can talk about quality and the existing quality measures we have, and are they good or are they bad? We can talk about that. We know they're not great. And based on our study, we know that there's a lot that's not explained in terms of, why residents are or aren't happy in a given nursing home, So that's what we really need. We need to understand more about that, and people need that information when they select a nursing home, because, this is an important thing, and they are putting their loved one there. So I hope that's helpful. I hope that answers the question. But I think that would be the line you would take as an advocate.
Mm-hmm. And go ahead, Eddie, if you wanted to make a final point. We're coming,
no, I was just going to address another question, but if we've run out of time, then I won't have time for that. So.
Yeah. So, and I think that this is we are out of time, and I think. The last question was a good place maybe to make a transition. And, certainly, this has been a fascinating project, and considering the information, that was shared today and the number of questions, it's one that, as you have stated earlier, Pam and Eddie, that this is an area where a lot more research and information is needed to be done. And this is really just scratched the top of the iceberg. And it's really incumbent upon us as advocates to be thinking about what is useful information that we need to be capturing, to be looking at in terms of useful information that's available for residents and family members in making their decisions about long-term care, and then how we can be using it as part of the advocacy that we do. And so for those of you that are on the call, we certainly would be interested in your thoughts about how this information would be useful to advocates, and what information would be collected so that maybe we can think about trying to do additional research in this area. I would like to thank Pam and Eddie for all of their work. Excuse me, I'm a little hoarse this afternoon. On this project. It's really been, as I said, an interesting project, and gathering some terrific information. And as the once the article is released, we'll be happy to share that with folks and let you know how to get it.
Sure.
The slides are available in the handout box, and we'll send those around along with the brief that Pam prepared for today. And we'll certainly be interested in continuing this conversation about how to use this information and how to capture it moving forward. Pam Moretti, did you have any final words that you wanted to share with folks?
Yeah, no, it's just a real quick response to one of the comments here is that, you know,
Sure.
that dissatisfied people tend to respond to surveys more frequently. Actually, there's been a bit of research with Yelp and Facebook and all those sort of social media platforms, and that's actually not the case. It's actually that on average the responses tend to be more positive. You tend to get people who, you know, but the big fear is it would be negative, but that's not what they're finding. So, but I appreciate this. This has been fun, and you know, we look forward to sharing, you know, more of what we did and our findings with you in the future.
Absolutely. Pam, any last words from you?
No, I think that's it. Thank you so much for listening, and I really hope that this has been helpful.
Great. Well, we certainly will. I know Pam and Eddie have had an opportunity to look at all of the questions that have come in, and actually we've hit upon a lot of them. We'll be sure to share any additional ones that come in with them. So if you have questions or information, we will definitely pass those on to them. So don't hesitate to let us know if you do have questions. And thank you so much for all of your work on the study, for your time at the conference and presenting the information last year, and for doing it today as well as part of the webinar. So thank you so much, and we will sign off for this afternoon. Have a good rest of the day.
You too. Take care. Thank you.